Welcome everyone, and thank you for attending the 2012 Alzheimer's Association Town Hall meeting hosted by the Cleveland area chapter of the Alzheimer's Association. My name is Steve Osgood. I will be your moderator this evening. I am a board member of the Cleveland chapter. I am also chair of the Public Policy Committee. More importantly though, tonight I'm an advocate for the Alzheimer's, just like of you attending this evening. We have limited time, so I'm going to make my remarks brief in order to get to the mission at hand. A year ago at this time, the Alzheimer's Association held 132 public input sessions around the country as part of an effort to shape the National Alzheimer's Plan. Our voices were heard and included in the plan that was released by the U.S. Department of Health on May 15, 2012. If you have not had the opportunity to read the plan in its entirety, you can find it at the website. I'm not going to bother repeating all this, I'll refer to it a couple times, but I encourage you to read the plan in its entirety. As described on the fact sheets that we've provided to each of you, the National Alzheimer's Plan has 5 overarching goals. First, foremost, begin and prevent and effectively treat Alzheimer's disease by 2025. Also, to optimize care quality and efficiency, expand support for people with Alzheimer's disease and their families, enhance public awareness and engagement, improve data to track progress. Tonight is an important step as we want to hear from you. Throughout this town hall, we want to hear from you about the challenges you face in dealing with Alzheimer's disease. Specifically, we'd like to hear about 4 issues that the National Alzheimer's Plan will address. And those main issues are, again, number 1, research. Tell us how important it would be to have an available that cures, prevents, or simply slows the process of this disease. As we all sit here tonight, we know that's something we don't have today. Your experience with the healthcare system. How much of a difference would it make if physicians and other healthcare providers were better trained to care for those with Alzheimer's and other dementias? Caregiver support needs. How important is it to provide better support for Alzheimer's caregivers? And the stigma about Alzheimer's disease. Tell us how the lives of those affected by Alzheimer's and other dementias would have improved if there was a wider understanding of and sensitivity to the disease. As I reminded you a year ago, for those of you that were here, you are the experts. And what we're looking for is to hear about the challenges you face or have faced and could be addressed by the government. You have made the effort to be here tonight, and by all means, make your voice heard. The only rules are going to be this that follow. Please keep it short because we have a limited amount of time and we're going to try to stay on schedule. Because we are taping this session, if you have a comment, please raise your hand and wait for someone to bring the microphone over. Your stories are always very important, but try to connect them to the issue that we're trying to solve. And I may at some point introduce a topic if I feel we have to move on to a different subject. That would only happen if we face time constraints. But at the end of the meeting or sometime afterwards, you have additional comments. Again, go to the website, plenty of opportunity to get your feedback and additional comments there. Tonight, we are very grateful to have 2 federal legislative staff members in attendance who will start us off with a few comments. First, please welcome Beverly Charles from Congresswoman Marcia Fudge's office. Bev?
Hello, and good evening to all. It's great being here today representing Congresswoman Marcia L. Fudge of the 11th Congressional District for this town hall meeting. These town halls are so important not only because we hear what you as advocates and caregivers and family members, your views and what your challenges are with that when you're facing Alzheimer's disease. The Congresswoman and I both have personal stories, which I really don't have time to tell you tonight, but we know the effects of Alzheimer's and what it can do to a person. With the national plan that's in place, we're hoping that we will soon have funding for research. There have been research dollars already advocated, and we know that without those dollars, we cannot find a cure, or we cannot find anything that's going to lead to maybe not the eradication of Alzheimer's, but certainly to slow the process down. So on that, I just want to say I am so glad that you're here, and I'm looking forward to hear your stories and what you have to say, so I can certainly take that back to the Congresswoman, and you can be sure that you have an advocate in Congresswoman Budge. Thank you so much.
Also, if you would join me in welcoming John Ryan from the office of Senator Sherrod Brown.
Good evening. Like Beverly said, we're really here mostly to listen, to take some notes, to bring it back to Senator Brown, and make sure that we hear what you're talking about. You're so lucky you have a good Alzheimer's chapter here. They've met with Senator Brown a number of times. They've met with me. You make sure you keep in touch with us, and we appreciate that. I will share two quick items. One is because of your voice. Senator Brown was proud to co-sponsor the Alzheimer's Breakthrough Act, which would provide about $2 billion to help with this disease. Research, help with the caretakers, also to caregivers, and also help with public education. That did not pass at this point, but your voice needs to continue to be heard around that, not only with the two members here, but throughout the state and throughout the country. The second thing I'll mention is we're here tonight in part because of this national plan that was signed on January 4th, 2011. The only reason that passed is because of your voice. And we really do appreciate your voice, and we hope we continue to hear it. The last thing I'll just mention is there's been a number of other bills passed that help people with this disease. And one of them, for example, is the Family Care Leave Act, allowing people to take the time off from work without losing their jobs. And when that was being considered, the senator was in the House, and he heard from a number of people with diseases such as this. My dad had Parkinson, a similar type of disease as far as the way it impacted him. And I know I was really fortunate to be able to take the time off to be there to help with the caregiving. And so your voice is so important. We want to hear it. Thank you for being here.
Thank you, John. As we open the discussion to everyone, I would like to particularly thank the many members of the Cleveland Chapter's Policy Advisory Board who are in attendance this evening. So with them in mind, why don't we start with research? Would somebody like to begin discussing the challenges they face within the research community today, or what advances in research would mean to you? And again, please raise your hand. We'll provide a microphone. As the microphone comes, if you could stand up, or I guess you don't actually need to stand up, it would be nice, but say who you are and where you're from. That would be great. So who would like to start?
Go ahead. I'm sorry.
Thanks, Ken.
Somebody had. Hi, I'm Ken Bravo from Cleveland, and for a long time have advocated on behalf of Alzheimer's and money for research. And my reasons are very simple. I don't know the answers, but I know if we give bright people the tools, they will find the answers. The story I tell people is when I was a child, I had polio. Fortunately, we don't have to worry about that anymore. My children, my grandchildren didn't have to worry about it. We have to do the same thing for Alzheimer's. We have to give the scientists the tools that they can use so that we can come up with the answers. Congress isn't going to be able to do it. The NIH and the researchers can do it. We're very fortunate that we have two members of our congressional delegation represented here tonight, but they're very supportive of us. It's the people in Congress who won't vote for this money that need to be heard from us. Thank you.
Thanks, Ken. Anybody else? Ed?
Yes, I'm Patty Gerard, and I have Alzheimer's.
1 second, we'll get
You think I need a microphone? I wish there was a way to give incentives for people to research Alzheimer's, because it's something we need to do right now. We need somehow to get the research ball going more than it is. I'm 58 years old, and I don't want to wait till 2025 or 2030. That's not going to be my day. Do you know what I mean? We need it now. So if there's some incentive or some way to get more researchers, get more money for research, and also an incentive for doctors, nurse practitioners, and PAs, give them an incentive to specialize in Alzheimer's, because you just don't find that anywhere.
Thank you. Would love to have somebody from the PAB make a comment and just some of the challenges they're facing from the research side. No?
Where are we on the
Research side, okay. Anybody else, just general comments about research, need for research?
Make it to
I
you.
need the microphone.
That'd be great. Thank you.
Hi, my name is John Zaccardelli. I'm from Parma, Ohio. And what the research means to me is basically how it affected me. I was dealing with Alzheimer's for 12 years in my family. And it seems to me like, as depressing as it is, when I asked about research 12 years ago, I learned as much as I could learn about it. And I asked about research today, it's almost like I'm back 12 years. It's depressing because we keep looking for hope. We keep reaching out and hoping that somebody will find something. And they throw us all these little tidbits of, hope, this new medication, this new trial, or whatever. Nothing materializes. And so I run a couple, I facilitate a couple groups, and it's really depressing for me to have to tell the people, I'm sorry, there's nothing we can do for you, this is going to get worse, it's not going to get better, and research isn't going anywhere. Now, from my point of view, research isn't going anywhere because in a lot of cases, Cleveland Clinic's doing their own thing, University Hospital's doing theirs, Mayo Clinic's doing theirs, and everybody in the country was doing their own. Now, I understand that it's changed, and that's a boon for research. But the difficulty that I have, like I said, it's been going on for so long, and I don't see a whole lot of improvement. So when I have people coming to my group and talk to the caregivers, and you tell them there's no hope for you, it's depressing. It's depressing for everybody. So I guess what I'm trying to say is I'm looking for something good to come out of all this research, and I'm not real optimistic yet.
And how hard has it been to find the communication of just about the research and where it stands?
Well, if you make it a point to read the fact sheets and all the updates that come out from the association, I mean, the association does all that they can do with the information they have available to them. But to really know what the effect is of the research, people are going to say, okay, we have all these trials, now we have a thing called trial match. If you want to put your loved one in and say, okay, well, you know what? Most people don't want their loved ones having a hole drilled in their head. Or they don't want to put them on a placebo or some medication that may or may not make them sick, may or may not improve anything. So it's difficult. It's just a difficult thing. And I'm all for research. I not only do I volunteer with the association, I walk with the association, I donate money to the association, but every time I look up, it's like now there's, every 69 seconds someone else is getting dementia. Pretty soon you guys are going to tell me, well, every 50 seconds somebody's getting it. And it's depressing. It's depressing not for me personally, but to have to tell people in my groups, hey, there's nothing really happening here, just keep coming, and your loved one's just going to keep getting worse and worse. And it's difficult. It's a difficult situation.
Yeah.
My name is Paula Ograki, and I'm here. I'm a researcher and clinician in Alzheimer's disease, but probably more importantly for this meeting, I'm a daughter. My mom died of Alzheimer's a few years back, and so I hear exactly what you're saying, kind of from both sides. The past 10, 12 years from when I started to now, there's not a whole lot more to say about the story. But what I do want to help people believe in is that for every dead-end road that research is, that's one road we learn from. And so don't get completely discouraged and negative about that. And what it really means, and similar to what our first brave gentleman said, we need so much money to go towards research, basic research. And when you look at how money is kind of proportion, Alzheimer's does remain very low. We probably don't have the right understanding and answers for the So that's why we keep going down the dead-end roads, which is why we need to keep putting money into kind of understanding the basics. And kind of from the person with Alzheimer's family perspective, please don't give up. If you don't involve yourself with research, if you're not willing to try, I remember my mom saying, well, no one's going to be able to help me now, but if there's any little thing I could do to help someone else, let me do it. And we all need to kind of keep that perspective. So thanks.
For those who just entered the room, we basically started the discussion on research. The question is really twofold as far as what issues as researchers, difficulties you've been running into, as well as for those as to what do advances in research mean to an individual who's either a caregiver or has the disease. And we would love to hear more maybe from the research side about some of the challenges that you might be facing. And we've asked that if you raise a hand, we'll get a microphone over to you if you would just wait there.
So with all due respect, sir, I think your actions speak louder than your words. I don't think you'd be here if you didn't have any hope. So I think that says something.
You're talking to me.
I'm talking to you.
One thing I know is we'll always have hope,
Right.
and we always believe in a higher power that can help us. And we keep putting our thoughts and our prayers there, and hopefully with his grace and with his help, these people that are doing all the research will come up with the answers. In my case, unfortunately, my loved one is gone, but I do have 5 children, and I'm concerned about what's going to happen to them, and my grandchildren, and my great-grandchildren. So it's just a real concern, and thank you for your comment, I appreciate it.
From a research perspective, a lot of the trouble that we have actually is the length of the illness is so long. I know it doesn't seem very long for the caregivers, but as far as medical illnesses is concerned, when you look at these studies, you have to try to find your drug and put it in a mouse, and then you have to try people, and that takes a long time, and that requires a lot of money that isn't around. So.
Yeah, I would say
and if you could say who you are.
Sure. Yeah. So I'm Bruce Lamb. I'm on the board and also a researcher at Cleveland Clinic. And I sort of agree, and I think one of the things that sort of begun to find out even more recently is the disease starts 10 to 20 years prior to sort of when the symptoms start. And so that brings extra, I think it's a good news, bad news. I think it's good news because this offers us the potential potentially to intervene in disease before sort of the clinical manifestations are there. But the bad news is most of the trials that have gone on so far have sort of targeted people well into the disease course and have unfortunately not yielded the results that I think any of the researchers would like to see. So I think there's great hope, on the one side, again, because we now know a lot more about this preclinical phase of Alzheimer's disease, but it brings up a lot more challenges because I think as Dr. Appleby was just saying, that also means how do we design, a clinical trial for something in preclinical testing. So before somebody actually shows the clinical signs, how do we do that? And these are discussions that are ongoing right now, sort of in the field. But again, I think people are very optimistic, again, long term that we'll get there. But I think it's going to require a lot more work than maybe when we realized, 10 or 20 years ago because of these new findings of how long the disease course is.
Right. And this may be a good time to mention that the motivation for Terry in his documentary is the loss of his father to the disease, or has the disease currently. But also I asked him how he would describe the documentary, and he says it's really the coming tsunami. And that tsunami, the costs are so extremely large. They're not just financial costs, which are astronomical. I mean, the estimate is by 2050 it's going to be $17 trillion, and most of it's paid by Medicare, and we all know the financial shape of the country right now. But it's also the personal cost, because as you mentioned, how long does this disease last? The caregiver and the support that needs to be given for this extended period of time. So I failed to mention that previously. Apologize for that, Terry, but wanted to get that in there. Again, anybody else from a research perspective, any comments anybody would like to make? All right, well, why don't we move on? The next item was your experience with the healthcare system. How much of a difference would it make if physicians and other healthcare providers were better trained to care for those with Alzheimer's and other dementias? For those of you, particularly caregivers that are with us this evening, maybe tell some of the stories that you've had to face as far as just dealing with the healthcare system and the difficulties you've had, or any other thing that you might want to share.
Break my own rules. First rule about documentaries, never get involved. But that is like very hard at this particular juncture. But what I do want to share is that probably like a lot of caregivers, my mother bared the burden up until the point to where after my dad had fallen a couple times, she couldn't pick him up anymore. And so a decision was made that he was definitely going to have to transition into assisted living. But because of insurance and all kinds of different complications, and he was a retired policeman, so he was a civil employee that had a certain medical plan that wasn't qualifying for Medicare, all these kind of things. We had to go through this process of like getting him admitted to the hospital so they could do an evaluation, and then after the evaluation, get him into an assisted living care facility. Well, as I was sharing with Steve, while he was in the hospital, he was administered Halidol and Risperdal as a chemical restraint, because the very last thing that they wanted to have happen is for him to be physically restrained in his bed, because if someone was coming in to evaluate him and saw him with physical restraints, well then all bets are off. And I can't tell you the number of different places that came to us, and the very first question that they had was, not how is he doing, or, how are you doing, but it's, does he have a tendency to get violent or unruly? And to me, it's kind of like you're putting parameters there that as a caregiver, you're just trying to do the very best you can for your loved one, and yet, it's kind of like, well, your loved one can be here provided that they don't act like someone who's, not really in their own mind at that point. So I'm just kind of interested from insurance and from a medical perspective. It's like, are we really adequately equipped to understand the true nature of the disease, how it manifests itself, and how difficult it is at this point to get the loved one the care that you want to get them and still be able to get some kind of financial relief in the process. So, put it out there.
Thank you.
Did you sign a release?
Yeah.
I know a guy.
Hi, my name is Samantha Brooks, and I am the caregiver for actually 3 older adults that live with me. But my mother has Alzheimer's disease, and this is her second time coming to this meeting, both of my parents. And from last year until this year, there has been a dramatic change in my mother. And to some of the questions that were asked in terms of whether or not the medical community is equipped to assist caregivers in the care of individuals with Alzheimer's, I say no. And that's not to say that my mother has not received good physical care, but there are very few doctors, in my opinion, in our area that really deal with Alzheimer's disease in the office when you go. They want to know, how is her blood pressure?
How is her energy level? Is she eating? You know, all the kinds of things that, measurements that doctors make when you have a physical or when you go in. Does she have a temperature? Does she have an ear infection? And all of those things are important, but it says nothing to address the disease of Alzheimer's. I think we have been fortunate because I work in the field of gerontology. I'm a social worker by trade and work with the Benjamin Rose Institute on aging. So I know about the disease, I know about the process, I know about caregiving, I know about burnout, but none of those things are really helpful because I have to do what's needed on a daily basis. And getting rest or getting help, that just goes out of the window because you do what you need to do when you come home from work. What I would like to see from the medical community is a greater interest or discussion when you go to the doctor about the measurements of her memory and how you've adjusted or how has she adjusted, and some, I don't know, ideas about how you can manage better. Because now it's all left to trial and error, what works for you. And so far for us, thank God it has worked. And just as a sidebar, my parents celebrated their 64th anniversary 2 days ago.
Hi, my name is Nirja Bhushan. I'm a professional occupational therapist, still working even though I'm past 70, doing a little bit of home health care, and mainly what I see are people with a little bit of dementia who have fallen and need me to get them back to doing what they need to be doing every day again. I love what I do, which is the only reason I'm doing it. And I love giving, my emphasis is always on, yes, we'll help the patient get physically as better as they can, but what's happening to the caregiver and what
to you know, the people that are going through it, have someone that's, you know, that's a patient, caregiver, whatever. It's almost like, you know, we're in a fight about it, you know, amongst ourselves.
One thing I've noticed about if you have a person who has dementia and they've gone to the hospital, what you really need when someone is in the hospital, you really need a family member or somebody who knows that individual well to be there all the time, because the reactions of the staff there interpreting what the patient is saying can be way off the mark of what is really going on and what is really needed. So we really do need to educate the hospital staff about how to relate and interpret what is going on better.
Okay, maybe switching over to the last topic, it's really the stigma. And Taryn, if you want to come back to yourself and talk about that.
Sure. Basically, you know, our family has a tendency to be very private, and my mom, for the longest time, just did not want anyone to know that he had even any signs of Alzheimer's. You know, she'd give him the little brain teaser, computerized things and stuff, and it's like, well, let's practice and all that. And I'm kind of sitting there going, because my grandfather had passed away from it. So I knew that there was a possibility that it would be in our family. But, you know, as things started progressing more, and his temper was changing and all that kind of stuff, my mom became incredibly more protective and more shielding of him. Like, you know, if we were in a public setting or something like that, it was almost like she was a linebacker or something like that, running block on him, so nobody would ask him a question or put him in a position where he couldn't remember what their name was, or, you know, so it was like this overprotective mode that continues to this day. So, you know, it's like, how do we go about making this something that it's okay to talk about? And it's okay to let people know that your loved one has this disease.
No, I had a question for Terry. I want to know if his mother knows he's making the video, but...
She will.
But I can say I've been involved with the Alzheimer Association since the late 1980s, and I think there has been a big change in terms of the stigma factor. Because when my father was diagnosed in the 80s, I never even heard of Alzheimer's, and certainly it wasn't something you mentioned. I think the fact that, I think when President Reagan his family announced he had Alzheimer's, it was a big breakthrough, and people were more willing to talk about it. There are still families, I understand, who don't want to talk about it. I think the fact that all these people show up tonight and will talk about themselves and their families. 25 years ago, you couldn't have had such a meeting. Nobody would have come to talk about it. So I think of all the things we've talked about, this is some place where we have made a lot of progress. Certainly we continue to need to do more. But in the years I've been involved, I've seen a great change in terms of people's willingness to talk about it. I mean, if you read obituaries in the paper, you will see today that so-and-so suffered from Alzheimer's disease. Many very famous people, well-known people, and people who are not so well-known. So I think families are more willing to talk about it, but we have to keep pushing that.
Pablo Castro from Cleveland. I'm also on the Board of Trustees, and my mother has early onset dementia. She was diagnosed in her 50s, but she showed signs well in her late 40s, in fact. And it was something that we didn't talk about, or that even to now, I have some of her sisters, my aunts, were saying, oh no, it's not Alzheimer's, it's dementia. But I think there's an old saying that the squeaky wheel gets the oil. And which I agree and disagree in the sense that we have grown from the earlier times of talking about Alzheimer's, but we're still hiding behind it. And there's still that stigma, as we're discussing right now, and there's still that, well, we're not going to talk about it until it's unavoidable to talk about. And there we talk about Ronald Reagan, which we heard rumors about him falling asleep in meetings or different things, but nobody talked about it until it was unavoidable to talk about. And then, of course, late deep into Alzheimer's, and we hear that our president had, our former president at the time had Alzheimer's. Now, as I said earlier, the squeaky wheel gets the oil. We kind of, and with all due respect, and myself included, hurt ourselves in that hiding, because now there's not that known want or desire, or that's not even the words I want to use, but the issue is not out there for everyone to slap you in the face every single time, as cancer, HIV, a lot of the other diseases are. I just went to several functions for breast cancer. Breast cancer now is, you see a lot of NFL players wearing pink. Actually, myself held a fundraiser. I teach martial arts as well, for cancer awareness, as a friend of mine had just beat, well, he's still on the progress, but beat stage 4 cancer. But those are popular. I mean, not that nobody wants to have cancer, but those are things that people talk about. And I've survived, and I've done this, and I've done that. But when we talk about Alzheimer's, well, you know, she just is forgetting something. Okay, yes, she had to retire in her early 50s, but, you know, that's, you know, something that we own to work with. My mother comes from a family of 19 children, so yes, there are a lot of people to care around, but there are a lot of people that did not want to talk about this. This is something that we put back on the side. Even when we talked to my mother and she was diagnosed, she was like, oh, this doctor doesn't know what he's talking about. And so the squeaky wheel gets the oil. We need to go out and talk about this. Not just at the time where we can no longer hide it, but when people don't realize it. If I saw you walking down, otherwise it makes you crazy. Other times, Patty, I would not know that you had Alzheimer's. If you saw my mother 10 years ago, you would not know, 15 years ago, you would not know she had Alzheimer's. So we need to talk about it. And we also, I held a meeting with several Hispanic leaders to talk about, organization leaders, to talk about trying to break the stigma and get some information out to the Hispanic community, as well as how do we better assist those people of the Hispanic community. And one topic that was discussed is being culturally sensitive and through medicine. And as I'm listening to this and agreeing and thinking about this and still thinking about it, and even today, if you think about it, with all our stories, from early onset to late to all different types of dementia or Alzheimer's, we are our own culture. And we have certain requirements and needs as a culture. And so when we talked earlier about the doctors or the medical services, and you know, my mother was told she had Alzheimer's, all right, have a nice day. And that's the fact. And luckily we found it out. And my mother and I grew up over in Northwest Ohio, Toledo, Bowling Green area. I brought her all the way over here to the Cleveland Clinic because my thought was the best of the best, or at least around this area. And now she goes to a family doctor over in Bowling Green who had somebody, whether in her life or her mother, who had Alzheimer's, and so she's part of that culture too. So she also has that sensitivity to be able to not only diagnose, assist, and help, but understand. And that's one thing that some of these doctors need to do is understand, or medical technicians, or people in any type of assistance medically. So as I said earlier, the squeaky wheel needs gets the oil. We need to start making noise. And we need to start, not that we're not already, but even more so. And even after we are bothering them, then we bother them some more. Even after they say, okay, we'll get to it, then okay, and then we knock on the door tomorrow, and the next day, and the next day. You know, and that's something that I think then we can stop saying, why aren't we getting the help? Instead of saying why, let's start asking for it. And if we don't get it the first day, then we ask for it the second day, and the third day, and then the third year, and the fourth, and the fifth, until they say, okay, let's go do something.
Rose?
My name is Rose M. Allen. I'm on the Public Policy Committee. I know it'll be hard to understand me, but I'm battling a little problem. But what you said is on target for what we need to do in terms of getting more visibility. I suppose I know that Nancy's been working on local high-profile people to come out and talk about either themselves or a relative having Alzheimer's, but I guess nationally, probably Glenn Campbell, having come out and acknowledged that he has Alzheimer's, is helping people become aware of it. But I think, such as we may need a major poster child, such as Magic Johnson was for AIDS, and people who have contributed to breast cancer awareness. The NFL teams will wear pink for certain games. Maybe it's time for them to wear purple and let everybody know this is Alzheimer's. Or the Major League Baseball teams, or any national or international organization, get some high-profile person to draw attention. Because in this country, people pay attention to, I don't call them celebrities, but high-profile people. And maybe that's that is what's going to happen in order for the rest of the world to kind of get the idea that Alzheimer's is anybody's disease these days.
Anybody else? It's interesting.
I'm sorry, can I just make one last comment and promise I won't say
You can
anymore?
talk as long as
If we go back 30, 40, 30 years ago, we're going to remember someone said something about a disease called AIDS. Who cares? Homosexuals get AIDS and drug addicts get AIDS, and we don't care about AIDS. And then we start seeing more and more people get AIDS. And then Magic Johnson, like she said, and all of a sudden we're recognizing, hey, this is for real. And it's the same thing with Alzheimer's. Most people don't even, they can't pronounce Alzheimer's, they call it old-timers disease or some other, just some other disease. So as more and more people get it, the associations do a tremendous job of making it aware. I mean, you see it on TV, you see it everywhere. So it's just a matter of, unfortunately, the more numbers we get, the more people are going to know about it. And you know, if you're not affected by it now, you're going to be. So it's just like these other diseases that came up. You know, initially we didn't care about them, but now everybody knows what AIDS is, and everybody supports the AIDS Foundation and all that. So it's just a matter of time. And the last comment I want to make is I wouldn't hide in the closet a person that has Alzheimer's, because my experience has been people who know that your loved ones or whoever you're caring for has dementia are really very compassionate about it. Whether it's in a restaurant, on an airplane, or wherever you go. I've always been, especially when my wife was still with me, the people were so nice when they knew she had a problem. It was never like, hey, what's this lady doing on a plane, or what it wasn't that way. So I wouldn't worry about trying to hide in the closet and not let anybody know, because people are helpful and they're compassionate. And the more we learn about it, the more we're going to have people understand how it is to help. So I'm done. Sorry.
All right, my last comment too.
Okay, promise.
No. I just need to say about, number one, the Foley Healthcare. That's been absolutely wonderful in my life. And more than that, the Cleveland, not Clearwater, I live in Cleveland, the Cleveland Alzheimer's Association saved my life, my daughter's life. We would not have known where to go. We would not have gotten referrals. I wouldn't have known about the Maria Shriver things. I'd probably be dead from suicide. Truly, seriously, if my daughter had not found the Cleveland Alzheimer's. I live for them. If they call me up and say, Patty, we need you to speak to somebody tomorrow at 9 a.m., I don't like 9 a.m., but I'll get out of bed and I will go and speak to those people, because I can't cure it. I can't give money. The only thing I do is tell people that I have Alzheimer's. Everyone you know is going to have Alzheimer's or take care of somebody from Alzheimer's. So you better jump on the boat and start helping me. And that's just what we've got to do. You know that I feel that way. You feel that way.
I would also like to express my feelings about the Cleveland chapter of the Alzheimer's Association. If there is any good side of getting Alzheimer's, it's the people that we have met in that organization.
Absolutely.
Who have all been beautiful and caring, and have really, really reached out to help us.
Save us.
And help many people. And I can't say enough of good things about the Cleveland chapter of the Alzheimer's Association. I'd like everybody to know that and get it documented on film.
One thing, I just wanted, in terms of the stigma, I think there's some two things that people have mentioned, sort of other diseases, and I think there's sort of two things I think that unfortunately right now are sort of unique about Alzheimer's disease. So one is, I think that it does affect memory, which is sort of how we define ourselves, really, at the end of the day. And so that's a very difficult thing to deal with, I think, when we lose our memory, because then that's really, we're losing ourselves. And so I think people are very uncomfortable with how to deal with it. And similar level, I think, of even some mental illnesses as well. And then on top of that, I think right now, unfortunately, we don't have any good therapies. And so I think that combination has, I think, made it particularly difficult to sort of reach through and sort of say, either, okay, you can survive this disease, because there's some therapy that can help, or, again, that there's something we can do. And I think that, but I think the important thing in my estimation is, one, certainly, having people like Pat Summit and other people who, really are out there, and out in the front lines sort of saying, yes, I have the disease, and other people here in this audience tonight. And those kinds of voices, I think, are ones that really speak loudly, to sort of say, look, we have the disease, but we're still participating in society, we're still involved in our communities, we're still, planning an active life in our communities. And I think that message needs to be reinforced over and over and over again.
Okay, I just wanted to say about the family not being comfortable about talking about Alzheimer's to other people. Well, my mother is uncomfortable. She doesn't want anybody to know about it. She had jury duty earlier this year, and with having Alzheimer's, I didn't think she'd be able to handle that. And so the day of, my sister and I took her there and kind of told them, that she had a problem with her memory, and they excused her, and she was furious. And I guess it's like taking away, it was something for her to do, and you're taking something away from her. And I was upset about that, of course. But again, if somebody asked her how she's doing, she'll say, oh, I'm okay. It's just that I can't, my memory isn't like it used to be. It's like it's with age. It's like it's not the disease, it's just coming with age. And, I kind of listen to her when she's talking to someone, and you hear her say, well, I'm all right. I says, well, you have Alzheimer's, but, I can't say anything. And then she's carrying on conversations with people that she hasn't seen in a while. And they have to, repeat themselves to her. And I don't want to tell them because she doesn't want it known. I'm sure there's other Alzheimer's, well, I won't say victims, but people that are dealing, that have Alzheimer's. I'm sure they feel the same way, that they don't want, people knowing about it, when they're first diagnosed with it, and they know this is happening to them. It's a problem there also, so.
Well, we're at the end.
Just a question. I heard Matthew Baumgart speak at the annual luncheon, and he compared the battle we're facing now to what happened with AIDS, and how President Bush came through and announced major funding unexpectedly for AIDS. I'd like to ask the representatives here from the government, in today's economic and political environment, how far away are we from that, and what is the best way to have our voices heard at the legislative level? Other than just picking up the phone and calling.
Well, I can only speak for my boss, okay? And I guarantee you, like I had said in my remarks, she has definite support for funding, for research. It's the other members of Congress who you have to get to come on board. So I tell people when they ask me, well, what's the best way to advocate? You don't need to send anything to us, but you need to develop a list of those members of Congress who you are not getting the support at this time, and just bombard their offices with letters and emails and all the other social media outlets that are used. I think that's about the best way that I can think of right now.
Yeah, and I would agree with what Beverly just said. I would add two things. One is Senator Brown is for sure supportive and understands this disease to the degree of needing more support, needing to make sure we do the research and we provide support for people caring for their loved ones. Ken Bravo never sees us without talking about this disease. And you have your unpaid lobbyists here. And so continue to do that. But, most offices, our office, every Monday, we begin by reviewing what the top letters are about, what the calls are to all of our offices and what the issues are. And if other offices don't do that, someone in that office is looking at that. And so I think people need to take a look and say who's with you and who isn't with you yet. The second thing I would urge is, these stories tonight, I have a whole page of notes, and we'll review that with the senator and with the other staffers who deal with healthcare issues. But the other thing is you have to take and personalize these stories in the other congressional districts that aren't, Congresswoman Fudge's. and go out there and make sure you educate them about the personal stories. Right? When the people in their 50s are talking about having this disease, well, I'm 52, so you start thinking, wow, this is something. Make sure you do that with the other parts of the state, and it really does make a difference.
What John said about personal stories, our communications director in our office, Belinda Prince, she is always seeking good human interest stories, especially about any of the healthcare issues, diseases. So we would be happy if you would like to call her and say, I have a personal story, and maybe we can use it. The Congresswoman does these teletown halls a lot of times, and she will be. So yeah, those personal stories are excellent.
And remember, everyone who's in contacting Belinda, who's great, in Congresswoman Fudge's office, you're also represented by 2 senators. So make sure you contact all of your representatives with those stories. Because when Senator Brown talks about these issues, you don't want to talk about $2 billion. You want to be able to talk about why, right? You don't want to be talking about, in code. You want to be talking about Ohioans. Because then people who aren't so sure about spending money, and we have to be careful about that. We have to be careful about where you spend money. But when they take a look, they say, this is my family, this is my neighbors, these are other
Make
people.
it personal.
Absolutely.
I have a couple things just to wrap up. One, Terry has asked if anybody would like to stay afterwards and be willing to volunteer some communication for the benefit of the documentary. He would love to speak with you. I'm also going to break the rule as moderator because I've done this 2 years in a row, and honestly, last year to this year is almost night and day. I mean, last year we had just gotten through NAPA. There was real excitement. I don't know if it's the failure of the 2 drug tests in the last 2 weeks that's got everybody a little down. It certainly got me a little bit down. But your opening comment about hope. Like Ken, my mother had the disease before there was even a term called early onset, before assisted living even existed. And I can tell you that what we have today and the direction we're on today is light years from where we were. To think that the federal government actually has not only a plan, actually has a website, .gov, that you can get on for Alzheimer's, I never thought I'd actually see that day. And so my hope is that there's a date. We are a country that seems to react to time frames, and Patty, I know 2025 is way too far away, but it is a date. It's better than not having anything out there. And, we had 2 failures of drug tests, but there's a number of other drug tests. There's a lot of research being done in Cleveland. It's a process, and I do believe that the things that we know won't work will help us actually find the answer that does work. I thank everybody for coming out tonight. Again, if you're interested in talking with Terry, he'd love to speak with you. And everybody have a good night. Thank you.